Hi, I'm Mina Malik Hussain and you're watching The Coffee Table, and today we're talking about a topic that fascinates us endlessly and we love having conversations about it. We're going to be looking at alternative therapies and alternative medicine with the focus on osteopathic medicine, which is one of the fastest growing sort of schools of medicine in the United States, and we want to sort of find out what's so great about it. Joining me on set today is Dr. Anwer Kamal, who is a complementary and alternative medicines therapist. He is a real renaissance man, and specializes in so many wonderful therapies, but his particular favorite and the thing that he's extremely good at is acupuncture. And joining me via Skype is Syed Haider Ali and Usmara Zafar, who are both physiotherapists who then trained at the International College of Osteopathy in Switzerland and have been working as a husband and wife team in Pakistan as the only two osteopaths that we have at the moment since 2012. Welcome to the show, everybody. It's a pleasure to have you here, Dr. Kamal.
Thank you.
This is wonderful. So before we sort of begin talking about osteopathy, Dr. Saab, tell us about what does complementary medicine mean? What does it mean, complementary and alternative therapy?
Actually, we live in the nature.
Yes.
And we have to survive.
Huh.
For that, we need everything what is around us. So, what suits?
Huh.
That's been complementary. And what can be given with others, without other help, that's our alternative. That's our options which are available in the nature. Actually, we suffer if we deflect from the natural way of life. We have the opportunity either to compel, to be lived with nature. Deflection means the troubles have to be faced. And the disease which we call, actually they are the result of deflection from the nature.
Oh, okay. So the root of a lot of illnesses and a lot of ailments are not always what we think they are.
Yes. Actually, that's what you can say, deflection means when you have to compel yourself to be lived in, otherwise you have to suffer.
And nobody wants to suffer.
Yes.
But when we say alternative, do we mean alternative to what? To conventional medicine?
Actually, the advanced countries had divided all the systems in two.
Right.
One is conventional, under which the allopathic medicines, pharmacy, nursing, physiotherapy, psychiatry, lab systems, laboratories.
Yes. All that kind of mainstream medical things.
They are under conventional system. Otherwise, from the National Institute of Health, Bethesda, USA, they have actually tested all other medicines which are available in the world.
Yes.
Wherever, in Africa, India, China, Pakistan,
yes,
or somewhere else in Arabics. Actually, what in India is doing, they are using urine of the cow.
Yes.
In some area, urine of the camel is also used as medicine.
Right.
They are using as medicines. Even the dung, cow dung.
Yes.
In India, they are using as, they are claiming, though not authentic, I can't say whether it is effective or not. Cow dung is using nowadays in India as COVID treatment.
Oh, that's very interesting. And so, Usmara, when we look at a lot of alternative medicine, and these are practices that are centuries old, and there are sort of, let's say like homeopathy, for example, has been practiced in a lot of East Asian, South Asian cultures for centuries. And there seems to be it's sort of now becoming mainstream because conventional medicine is now sort of testing things and different practices as well. So what I'm basically actually asking is that how did you and Haider make the move from physiotherapy, which is a more kind of conventional approach to the body, to osteopathy?
So, thank you so much for the question. So actually, I worked as a physiotherapist for 10 years.
Huh.
I help my patients in their musculoskeletal issues, injuries, neurological issues. But sometimes I really feel myself helpless because I was unable to help their other problems like headaches, migraines, sinusitis, different type of infections, chronic chest infection. They were spending so much money and time to get rid of all these ailments, but the relief was never permanent. There was no permanent cure. So the situation of helplessness was quite frustrating for me because at the same time, at times, I couldn't help their pain as well, completely cure their pain completely. For sure, I could help them a lot, but sometimes I couldn't cure their pain completely.
Yeah.
So, and they were spending so much in all these medicines and things like that.
Right.
At that time, during that, I got a chance to study osteopathy. I got a scholarship for osteopathy. I didn't know anything about osteopathy. I read about osteopathy, and I came to know that osteopathy is not only effective in maintaining these musculoskeletal and postural issues, but it's at the same time it can affect these digestive issues, urogenital, gynecological issues, and different type of infections. Yeah, and in this osteopathy, we don't need any material, any modality, any medicine.
That's fascinating.
So then I read more about osteopathy, and then I came to know that it's the fastest growing allied health profession in Australia.
Yes.
And it is very well practiced in Europe, Canada, Australia, New Zealand. So then I immediately decided to start studying osteopathy.
Yeah, that sounds
now
like a good
I
idea.
can help my patients more efficiently.
That's fantastic. Haider, coming to you, could you sort of explain what osteopathy is?
In fact, osteopathy is not only a science, it's an art of healing the human body on the basis of the knowledge of human body on anatomical basis, physiology. Like you can say that on the basis of all medical sciences of the human body, we develop our palpation skills to treat the system. So we don't treat the symptom, we treat the human body. We take it as a one single functional unit.
Right. So you're treating the body as a whole. You're not targeting one area.
No.
Yeah.
So everything affects in the body to the other system. Like your head can affect emotionally your whole body. When you're depressed, you're not able to perform. So your whole physical system is shut down because of that pressure.
Yes.
So when we treat the brain with our hands indirectly, or we find some other restriction in the human body, we try to help with our hand. We don't need any chemical or any modality. It's just our hands, and we try to restore the balance of the human body with our techniques. And that helps a lot. So that's why I was really interested in osteopathy, and we are really thankful to the Osteopathy Without Borders, which provided all the funds for our traveling for 5 years to Switzerland. It was not an easy job.
Quite right, I can
Thank God we did
imagine.
it.
So, Dr. Kamal, isn't this also the foundation of alternative medicine, that you have to see the body as a whole and everything
Actually,
and restoring balance in the body?
Yeah. Actually, all of the systems are under, you can say, holistic medicines.
Yes.
That means you are dealing the patient or the body as a whole.
Right.
You are not treating a single part. As in osteopathy also. I mean, it was started in 18th century
Yes.
by Indus.
Yes.
He was not a literate man, but he have started, and now the osteopathy as one of the subject under holistic medicines.
Yes.
Mean as a whole.
Yes.
Treating whole body. Not the disease, not a part, not of that. That means actually we all are dealing with the WHO definition.
Yes.
That means
Huh.
we the health is defined as WHO. Mean economically,
Yes.
physically, and mentally,
Right.
and environmentally fitness of a body. That's mean health.
Quite right. And like you said in the beginning, the environment has an effect on our body. So how we interact with our environment is
That's
also
true.
important.
All of the systems other than conventional, that means CAM.
Yes.
This osteopathy also comes under CAM
Yes. Yes.
as a holistic
Yes.
medicine.
Absolutely.
ठीक है ना?
Yeah.
It's a part of. Otherwise, as broad, we can say, mean osteo mean bone,
Yes.
pathy mean treatment.
Yes.
So it's not only the treatment of bones. Osteopathy is the treatment of, as I, by my knowledge,
Yes.
again, it's the bone treatment,
Yeah.
muscle treatment, nerve treatment, mean the feelings of the body
Yes.
is there.
Yes.
Even mentally,
Yes.
means psychologically. So we have to treat as a whole.
Yes.
So it comes.
You can't
under-
have one without the other. Huh.
Yeah.
Huh. Quite right.
That's why a patient should contact to that therapist which knows all of the systems,
Yes.
mean as a whole,
Yeah.
and the patient's troubles
Yes.
to be removed by which therapy?
Yes.
Not only osteopathy or acupuncture or some homeopathy,
Yes.
but
And when we have access to conventional and alternative medicine, what we're doing is that we are widening the pool of options for a patient to manage their symptoms or their pain or sort of, whatever issue that they're facing. We're going to take a very quick break here. Stay with us. We'll be back in a minute. Welcome back to the coffee table. We're having a fascinating conversation about alternative therapies and osteopathy with osteopaths Syed Haider Ali and Usmara Zafar and Dr. Anwer Kamal, who is a complementary and alternative medicine therapist. So before the break, we were talking about how osteopathy is non-invasive and it's not dependent on drugs. But before we get to that, Usmara, can you tell me what's the difference between an osteopath and a chiropractor, if there is any?
Yeah, for sure. Actually, an osteopath and a chiropractor share the basic philosophy that the integrity of the spine ensures good health.
Okay.
But at the same time, an osteopath tends to address more problems than a chiropractor, which mostly focuses on joint and muscle pain.
Okay.
And an osteopath never applies blind external force.
Okay.
He's extremely gentle and respectful of body physiology, tissue texture.
Huh.
Nothing is forced back into place in osteopathy.
Right. Because, with practice, one has that idea, not that they kind of crack your back and then sort of put everything back in line.
Yes, we do the same thing, but in most of our techniques, we really respect the physiology and texture of the tissue, and we try not to apply blind external force. So whatever we have gained, then it sustains as a system because we are respecting the physiology and normal body texture of it.
So what advantage does that approach have when you say respecting the body and not sort of applying a lot of external force?
Yeah, actually problem is that an osteopath restores balance to the body and to gain whatever he wants to gain the results, to whether it is to remove pain, to treat infections, sinusitis or gynecological lenses. The treatment is all about restoring balance to the body. But osteopaths strongly believe that the body has its own self-healing mechanism within the body.
Right.
Within certain limits.
Okay.
So as an osteopath also only plays a role of a fulcrum around which body reorganize and reset itself to promote its self-healing mechanism.
That's really interesting. So Haider, what does it mean when we talk about the integrity of the spine? Why is the spine so important?
Actually, for us, everything is important, not only spine.
Yeah.
In osteopathy, we don't just work with the spine. We have to work with every single tissue of the body if it is needed. But in chiropractor, they mostly focus on the spine and the joints. But we touch not only spine, but we try to restore the balance of the organs. In fact, we follow the demand of the body, we follow the tissues. We don't force by our own. We have to see what is the demand of the body for today. And we can't make recipe for the future treatment. We have to see every time the patient, now what is happening. So we touch the body and we have to feel like we technically are in dialogue with the tissue. That's why we are so gentle. We don't force too much.
Yeah.
This is the difference between chiropractor and osteopath. The osteopath is very gentle and he is just listening to the body. That's it.
But that's really fascinating, Yes, sir.
But spine is also very important. There's no doubt. There are a lot of nerves. They are coming from spine to our organs. Yes, we do work with the spine as well, but we are not limited to spine.
Yeah. So, and because as a layperson, what does it mean to sort of for one's osteopaths to be listening to one's tissues? Like how? And clearly, and this also means that the needs of the body change. So I imagine that when one system is sort of balancing itself out, then the need for balance moves to another system, like the lymphatic, for example, if we're moving from, X to Y.
Look. Then I have to go into bit detail.
Yes,
to make you
please.
understand.
I want to know.
Like when I was in first year of my osteopathy and second year, in first 2-3 years, we are like trained to understand the mechanical system only, like spine, joints.
Right, and like how muscles move and all of that.
Yeah, that's it. So from the spine, the nerves going to your digestive system as well, to your other organs. So like I was treating one of my patients, she was an old lady with the chronic constipation and backache. She was coming for back pain.
Yeah.
So I treated her spine according to what I learned at that time. And after 5 days, she said, look, my back pain is still there, but for some reason my constipation is gone.
Wow.
The reason is that I was treating her back but from the low back, some tissues are connected strongly to your intestinal bag.
Yes.
So when you have a back pain, sometimes that tissue can pull your intestine and you have trouble with your intestinal movement. So when you treat the back, you are in fact indirectly helping the intestine. And sometimes when you have a constipation chronic and you have some diarrhea, your intestinal bag is going to affect your low back. So you have back pain when you have a diarrhea sometime.
Okay.
So we treat the intestine. So we have to see for that day, is it either intestine is a primary issue for today or spine? That's the difference. So we need to work first on that thing which is more important for today.
Yeah.
And then when patient comes after a week, 2 weeks, we see how body is working. Is it needed more or not?
That's fascinating. Usmara, this also means, I imagine, that one has to have an ongoing relationship with one's osteopaths. It's not just that, you see a doctor, they do a therapy and, out the door.
Yeah, you're right. Actually, is there sometimes now, as the people, osteopathy is growing rapidly, its reputation is growing rapidly in Pakistan.
That's
People
great.
love it because of its, not only because of its gentleness, its effectiveness, but at the same time, they can think better, they can behave better. They can feel that after the session, they can perform all his or her duties in a better way. You know, because it really creates balance. Our body is existing at 3 levels at the same time: mental, physical, and spiritual.
Yes.
And these 3 components should be in a balance to perform better in our daily life activities. So osteopath not only address the physical thing, it's also it takes the body as a whole because of its holistic approach. So it addresses the body at all levels.
Yeah.
That's why it's so much helpful in anxiety, you know. Because anxiety is not just a feeling nervous, it affects the whole body at the time. So we can consider osteopathy as one of the available tools for managing anxiety, because an osteopath addresses the body and mind as a whole.
That's fascinating. I want to sort of come back to that. But before we do, Dr. Kamal, you also see a lot of patients with these kind of bone and kind of physical, you know, like sciatica and like Bell's palsy and things like that. And then you also have, for example, acupuncture. Tell us a little bit about that, because people seem to have a lot of these kind of really physical issues which are being resolved by these like minimally invasive procedures.
Actually, I'm specialized in acupuncture.
Yes.
That's why I'm treating all of the systems.
Yes.
That's mean all type of diseases. In acupuncture there is. Actually for that we have to come under one roof. That's mean naturopathy.
Right.
As in advanced countries, they have adopted all as naturopath.
Yes.
Mean they are producing 4.5 years course of proper ND doctors, mean natural doctors.
Yes.
Say with the same quality, with the same qualification, but with more knowledge. Mean they are adopting all of these holistic and conventional system also they are handling. Mean they are allowed to prescribe the allopathic medicine also. Because they are treated, they are taught. They are taught.
That's very important, because that also, I suppose, increases a patient's confidence in the practitioner also. You know, that they've got this proper degree, they've spent many years being trained.
We have to guide the patient, as well the environment also, precautions and other medicine intake and side effects of that. We have to tell about and guide about all these things to the patient.
Yes.
I mean, I am doing in osteopathy also, mean treating the bones, nerves and muscles. That's mean that. Mean even psychology. We have to consider, we have to taught the patient how to live, how to eat, how to act, how to exercise, mean all these. In acupuncture, I am doing compressed vertebrae.
What is that?
Cervical spondylosis. Mean that's mean they are not aligned. The vertebral column is not aligned.
It's not aligned.
Either mean scoliosis or compressed or slip disc. I'm doing that. Mean though it takes time in acupuncture, but gives relief in one day. The pain is removed as the pains in the hands or pain in the legs. That's mean called sciatica.
That's
lumbago,
quite right.
That's mean lumbago means
low back pain.
Low back pain or back pain. That's true. The shoulder pain or the numbness of this and cracking of the neck. Means slip disc. The disc is slipped due to environmental effect. Mean he have to expose with the cold winds. That's why the muscles are stretched on one side and the other is that. Mean imbalancing the vertebrae. Mean the column.
And so, everything, and again, it's a matter of balance, isn't it? That if one thing isn't balanced, then so many other things just fall apart.
In the start, I have said that We have to live in nature.
Yes, and
so
good
we have to
health
compare.
is all about
Yeah.
balance.
In
Yes.
winter, we have to wear the warm clothes
Yes.
to warm our body.
Yes.
But in summer, we live without.
We are free.
Whatever. So that's true. The effect, we have to manage the effect of the weather. They have to. We actually, all of these holistic medicines have to come under one roof.
Yes.
That's mean naturopathy.
Yes.
We have to, as in India have also started under Ayush.
Ah, right.
ठीक है? They have included the natural and the Ayurvedic system
Yes, that's
on one roof.
And again, Ayurveda is also such an ancient approach to learning and healing, actually,
Healing.
more than healing. We're going to take a very quick break at this fascinating juncture. We'll be back in a minute. Stay with us. Welcome back to this fascinating conversation about alternative medicine and osteopathy that we are having with complementary and alternative medicine therapists Dr. Anwer Kamal and Syed Haider Ali and Usmara Zafar, who are osteopaths. So, Usmara, before in the previous segment, you were telling me about how the body has a self-healing mechanism and that osteopathy helps the body kind of activate it. So, what happens? What happens in our bodies? I mean, sort of, what are we doing? Do you feel like our lifestyles and the way that we, interact, like Dr. Saab said about, the way we interact with the environment and our lifestyles have changed so much that we are kind of getting in our own way as far as our journeys of healing go?
Yeah, as an osteopath actually realigns the balance and positioning and restore mobility to the all bones, ligaments, organs, and after that, our health is actually basically dependent on good blood supply, good nerve supply, okay? And good drainage, good lymphatic drainage, good nerve conduction.
Yeah.
So sometimes it happens by the slight displacement of different organs or bones or muscles. All these longitudinal structure, they can't function in a proper way.
Yeah.
So by restoring positioning and alignment to all these areas, we're actually increasing, we are actually releasing the pressure on arteries, nerves and veins. So they start functioning in a better way.
Yeah.
They start supplying good blood to in a better way.
Yes.
They start draining the specific area in a better way.
But how do they become unbalanced? How do they sort of fall out of place?
So what I was telling you, that we are existing at three levels: mental, physical, and spiritual.
Right.
We can have mental traumas, we can have physical traumas, and we can have some spiritual traumas even. And all these traumas, sometimes our daily activity, routine, we are leading a very stressful life, or we are leading a very physically stressful life. So all these factors, these tensions are absorbed by our bones, not our bones, except there is a physical illness, but by our tissues. Because we are more than 60%, we are water. Even our bones are 30% water.
Really?
So
I didn't know
this
that.
tension, yes. So the tension and stress is absorbed by all the tissues. That's why we're called osteopath. Osteo means structure, all living matters, includes arteries, nerves, veins, viscera, fascia, everything. So all these organs or these parts have water. So they can receive or they can be affected by these stresses, whether they are physical or emotional. And gradually they start becoming tight. So if it remains untreated, then there will be poor drainage, there will be poor good supply, poor nerve supply, and then slightly they start displacing and they start becoming tighter. and eventually they will stop functioning in a normal way. So basically it's the basic principle of osteopathy. The structure governs the function. That if a structure is not in its position, not in its alignment, it can't perform well.
Quite right. Like logically, that makes a lot of sense. So Haider, tell me, in your practice, what are the most common ailments that you treat? Like, what are the more common things people come to you for?
In osteopathy, when we gradually grow in our profession, we don't have any specific patients. Like, you can't say that I'm just dealing with a backbone problem or backache. Now, after this, 9-10 years of practice, the people do understand who come to us on a regular basis that we help in almost every dysfunction of their body. Either it's emotional, physical, psychological, or whatever. So there's no specific thing, but yes, still, because we were first physiotherapist in our 10 years of practice, the people who came to us at that time, they remembered that we treat back pain. So sometimes they come back pain, but when we start treating, again, earlier I said, by treating back pain, you are helping their constipation, you are helping their breathing problem. So now it's a general practice. So people come for everything.
So it's a sort of, would you say that it's a myth that osteopaths only treat back pain and sciatica, things like that? It's a much more kind of rounded approach to health than just, bone trouble. Like bone trouble.
So it's not only now confined to the bone, it's everything.
Quite right.
People come for headache, for their stress issues, for their digestive problems. Sometimes they have breathing difficulties because of the tight structure in the body. So we help them.
So tell me more about your osteopaths, the Osteopaths Without Borders project, because I do believe that you have been working in KP, for example, and that there are plans to sort of put together a much more formalized institution where people can be trained in osteopathy.
Without Borders, in fact, aims to open a first college of osteopathy in Pakistan, which is in fact going to be the first college of osteopathy in Asia.
Ooh,
because
well done.
Right now there's no official college in India, China, Pakistan, Iran, no, even not in Far East. So this is really something very, very important for Pakistan that we are praying. In fact, we have worked with Osteopathy Borders since 2007. We are trying to open a college, and finally now in Khyber Medical University, Peshawar, hopefully this year, if the travel restrictions are over, or next year, the first college will start functioning.
That's fantastic. Do you find people that people's perceptions about osteopathy are changing as well, or do you feel like there's still a way to go because there isn't a clearer understanding of the benefits of osteopathy?
In fact, it's in middle of the way, because osteopathy is really appreciated if you experience. Without experiencing osteopathy, it's not that easy to make you understand how it works. People who are in touch with us and who have been treated in the past years, they appreciate it, and by word of mouth, they are spreading this news.
So, Usmara, I was also thinking about how osteopathy, like many other alternative medicinal practices, actually really suit low-income countries, because it is in itself also a kind of a low-input approach to good health. Like, you don't need equipment, for example, for osteopathy. You don't need any special equipment. You don't need any kind of special medicines. It's just a very hands-on, person-to-person approach.
In Pakistan, osteopathy because it's a natural form of medicine and cost-effective treatment, can greatly help the overloaded healthcare system of Pakistan, because it can take care of a lot of functional problems, and we don't need, as I have already explained, any medicine and any modality, anything. We just need our hands and patients. And and actually, where the patient is coming to us for one problem, but with the help of this osteopathy, we can help so many other problems at the same time because of this anatomy and physiology of the function.
Quite right.
So, osteopathy can be used in conjunction with allopathy and physiotherapy, so allowing fuller and faster recoveries, so increasing health and decreasing cost. I strongly believe that presence of an osteopath in our healthcare system really allows the allocation of financial resources and allows the high-tech medicine treatment to the patient who actually need it, because it can take care of a lot of functional problems.
Quite right. I think that's really important. So, Dr. Kamal, I think that what Usmara said about having options is something that we've also been talking about, is that when we are looking at different methods of healing in a complementary way, then you can combine allopathy and sort of alternative other ways, so that we just have a broader range of treatments for patients. We have more options.
Yeah, if you have a knowledge, you can prescribe other medicines or other ways. But it depends on the basic studies who have done. Because as I'm basically pharmacist, practically acupuncturist, or I have studied roundabout this CAM system. I know, I think 120, 25, 27 systems of medicine.
Wow.
They are practicing in advanced countries. There are, actually we need also one roof as a naturopath. Mean to treat as a holistic, mean as a whole, all of the patients. We have to obey all the rules with no foundations. Mean if I am practicing acupuncture, I need also for some painkiller medicines also. Either allopathic, mean conventional, or some herbal, or homeopathy. I'm homeopath also. So we can use whatever suits to the patient as per need. So everyone have to come under one roof. That requires some place. That's mean a roof.
Such as an institution.
Where we can adjust all these systems in one way. I can help.
Absolutely.
I can help. I can teach acupuncture. I can teach homeopathy. I can teach Ayurvedic.
And
I can teach herbal system.
Absolutely. And what I find really interesting is that as somebody with a traditional doctorate degree and somebody who has learned so many other therapies as well, both of them are working in harmony with each other. It's not in opposition.
It should. Actually, we have to come together. As I told in my conversation, that a hospital, how a huge crowd. It's very difficult for a doctor to treat so much patient. Under rules, only one doctor can treat 80 patients. Maximum. 100 as an Asian doctor. And take one. The load is there. So we can treat 120. As I have dealt 120 patients per day. In acupuncture, I have treated in one day 300 patients per day in my daily clinic.
Wow. That's a lot.
Treating acupuncture. Giving them allopathic medicine, giving them Ayurvedic medicines, though I was not familiar with homeopathy, with herbal system, tip system, I was advising as per need. So because I have studied, I know as a pharmacist, I know the pharmacognosy effect of herbal medicines. So
I love that. I think it's really the best of both worlds, and it's so fascinating to consider how we can be looking at all sorts of different therapies that work in conjunction with each other to sort of help us be as healthy as possible and as balanced and whole as possible. Thank you guys for watching. I hope that this was as informative and enjoyable for you as it was for me. And if you're watching this on YouTube, don't forget to like and subscribe, and we will see you next time on the coffee table. Bye now.